So what we've seen globally, and this is from Global Health 50/50, which publishes all of the sex disaggregated data available internationally. In aggregate, for every 10 women, there are 10 cases of COVID in men, 20 ICU admissions related to COVID in men, and 13 deaths in men that correspond to 15 confirmed cases of COVID that have died in men. So clearly a difference in mortality by sex. While that's widely reported, higher rates of men dying than women, we know that that sex difference doesn't hold across different racial and ethnic groups because of work like this. This study examined the intersection of sex and gender with race and ethnicity in Georgia and in Michigan. And in this study, you can see first panel is Asian Pacific Islanders, the second panel is Blacks, the third panel is whites. Georgia on the left, Michigan on the right. And you can see these age-adjusted mortality rates are highest in Black men, and in Black women, the age-adjusted mortality rates for COVID-19 are 4 times greater than that of white men, 3 times greater than that of Asian men, and higher than Asian and white women in these states. We know that there is geographic difference. There are geographic differences, and this data highlights the importance of examining local level data, of looking at intersections between sex, gender, race, ethnicity, and age. Actually, that's not demonstrated here, but that's very important as well. From an immune perspective, we're seeing differences in how older men respond to infection as compared to older women. And there may even be a specific immune phenotype that we see when older men are progressing. That's why we have to examine that data by sex, gender, race, ethnicity, and age. In this case, this disturbing data shows that disparities in mortality are replicating existing racial, sex, gender, health inequities in those 2 states. In fact, Black men and Black women had the highest rates of cardiovascular disease in those states already, higher mortality rates. What about the long-term consequences of this pandemic and long COVID? So in terms of acute patients that are severely ill, I showed you ICU admissions. Here from this study from the Lancet, severely ill patients, men represent 2/3 of those. Hospitalized patients, this is from a Wuhan study. And then over of those that had symptoms 6 months after the onset of disease, most were women. So the different pattern there. And those common long COVID symptoms are fatigue and muscle weakness, sleep difficulties, anxiety or depression. And in fact, in another study, a significant number of individuals who had long COVID were unable to work full-time 6 months after onset. So clearly, we need to be able to examine that information and better understand what's beneath that.